patients don't even know that Smile Express exists.
I was shocked. This isn't for necessarily people who are looking for a deal. This is people who want convenience and an outcome of just a cosmetic correction.
If these patients are going to be treated elsewhere with no supervision, how can this possibly be a bad thing?
I'm Dr. Scott Law, and I want to thank you for tuning in to the Smile Doctors Off Mute podcast. I'm really excited about today's Smile Doctors Off Mute podcast. We have a panel discussion going, and this is the first time we've done this. And so what we've done is assembled several of the most expert orthodontists on Smile Express to talk to us today about the benefits that Smile Express has for our patients, for us as practitioners, and just the great thing that it is inside of our practices. So I'm happy to welcome today Dr. Zach Casagrande, Dr. David Jones, Dr. Jessica Itani, and Dr. Amanda Gallagher. So Smile Express was Dr. Zach Casagrande's brainchild. Zach, why don't you tell us a little bit about it and why you started it, some inspiration behind that, and then how patients benefit from it?
Sure. Well, thanks for having us. I think this is great for smile doctors. This is great for the profession, and I think it's, in the end, this is great for patients. Any of us that were practicing back in 10 years ago, really 2015 to 2017, it was the beginning, the boom of do-it-yourself aligners. And we as orthodontists, I think we knew what was happening. We didn't know how it was going to play out, right? So about a year in, I started seeing, just like all of us did, patients in my office on a weekly basis, which turned into a daily basis. And they were going through treatments with these, do-it-yourself aligners at home with no supervision. And in my head, I was like, okay, well, I'm thinking two things at all times. How can I benefit the patient? And obviously, as a practice, this would be great. So I looked into it, and what I saw was alarming at the time. Was the industry was not being cannibalized. It was actually, we were gaining every year. We were going up, but we also saw this whole other funnel of patients that was seeking this type of treatment. So in my head, I said, okay, well, we could benefit as a practice. And this is a big service to patients that are going through this treatment unsupervised. I was seeing the negative results, terrible results coming into my office, bad bites, pain, teeth in places that I had never seen before, root resorption, things like that. And look, we can make a huge impact here. So I sat down with my associate doctors at the time. They thought I was crazy. And I'm like, this is what we're going to do. Let's do it. It's going to be supervised. It's going to be real Invisalign. It's going to be watched by us, real orthodontists that not only are orthodontists, but very proficient with Invisalign and aligners in general and real Invisalign. That's how it started.
Love it. Love it. So innovative. And I know since then, there's been multiple companies that have come to market over the last few years, right? And to try and serve this segment of the population, which is in the billions, some estimating $14 billion range of people who are going unserved or underserved. And I just know the benefit of orthodontics and the changes that it makes in people's lives to have their teeth straight, a smile that they're proud of. It just makes me so sad that patients it's almost like orthodontists say, hey, you can have full treatment or nothing. And so there's that big gap that doesn't get treated. David, tell us a little bit about your first exposure to Smile Express. What were your thoughts about it right when you heard about it?
Yeah, so I was actually following NVO, Zach, and Smile Express actually had his own Instagram page. So I was following that before the launch to Smile Doctors and thought it was just a great idea. We actually kind of dabbled with doing some ourselves. And then once it was introduced to Smile Docs, I was all in. I thought it was just a wonderful competitive product to DIY, competitors. And it's doctor driven. It's at about the same price point. So we were basically kind of all in. I mean, it's, we set up the prescription from the get-go. We follow the patients. We track them through SDA. I'm following the treatment. We see them back after they finish with their 20 sets of aligners, and we determine if they need a few more, or most of the time, since they're motivated to wear them, gets finished, we scan them for retainers. So it's just a very simple way to get more patients in the office, that aren't looking for a full bite correction and want something done quickly.
Absolutely. Amanda, you have some experience with this, with the patients that you serve and kind of what they're after, very aesthetic driven, your practice. You have a huge Instagram following. What do you see different with the patients who are looking for Smile Express versus those who are looking for, a full comprehensive correction?
Well, I think that that's where we have so much potential, is that patients don't even know that Smile Express exists. And so it's our job to teach our patients right now that this is, in fact, a product that we as orthodontists can recommend for their treatment. And it doesn't have to be full treatment. Prime example, I'm always looking, for like cosmetic enhancements and cosmetic ways to treat, like with a face, and knowing that people, a lot of the people that we're looking for these DIY companies, they're just not even walking into our practice. So right now, they're not coming and asking for it because they don't even know it's an option for them. So it's just this is like your retainer checks. Like today I had a scan for a new retainer on a mom. And it was in my de novo where we just opened the office. And unfortunately, her kids had started at a competitor orthodontist down the road prior to me opening our space. And she's like, oh, well, I just want retainers. My kids are in treatment with the orthodontist down the street. I would have brought them if you were here. And she had crowding. And so, for me, I was like, well, you can do something to improve your smile. Like, is it something that you'd be interested in? Well, no, my kids are in treatment. I want to focus on them. And I let her know about Smile Express. And there is, in fact, a way that you can update your smile and just cosmetic improvements. And it's not going to be a full treatment. And would you like if I could do these changes? And she was like, yeah, well, I guess if insurance can cover it. We went through, insurance didn't cover over 19 years old. But like with the monthly payments, we were able to make it work for her. And she's like, wow, she wasn't coming and looking for treatment, but I advised her we absolutely could treat her, even though her kids are being treated somewhere else, with an Invisalign product. She could get those cosmetic improvements with a Social 6. It's like upper and lower canines, minor tooth movement kind of thing that would make her feel happy and confident. And again, if she was already going to spend the money on a retainer, why not upgrade her and get her to start treatment in our office? So it's more about us making patients aware right now. And then as things continue to progress and the word gets out there, I do think, there is a huge untapped market that is interested in this type of convenient treatment, but it's convenient, not only convenient, it's safe because we're overseeing it as a doctor.
Love it. Love it. I have to tell you, the kind of patient that it just surprises me so much who's attracted to this is I am friends with an orthodontist who is going through with a professional sports team. I can't say who, I can't say what, but they went through and they were looking to make mouth guards for any of the players who wanted one. And it was amazing to see. This orthodontist was blown away how many of these players, I think it was 2 or 3 on this team, had DIY ortho being done at the time. And so I'm looking at that. It's like clearly these guys can afford to, to pay for orthodontics, but it was the convenience aspect that they were so interested in. That it was simple. That they didn't have to go in multiple visits to go see the orthodontist. They could clearly be monitored from afar. Like that's really what they wanted to have happen. And so that opened my eyes to this. I was shocked. This isn't for necessarily people who are looking for a deal. This is people who want convenience and an outcome of just a cosmetic correction.
Scott, it's so true. So like our patients, we see them twice. We see them once for a consult and a scan. We explain the process to them. They get excited when we tell them about SDA and about how we're basically seeing them for a virtual appointment every time they put a new set of aligners in. And then we don't see them until the end of treatment, and they're usually happy with everything and ready to be done. So we scan them for a retainer and mail them the retainer. So they're in the office twice. It's super convenient for them. Smile Express is awesome in metropolitan areas, but it's also super convenient for rural areas. In Roanoke, we actually have patients that travel 1.5, 2 hours away to come see us. And they don't want to come in, every 2 months for appointments. So we scan them the first day when they get a set of comprehensive records, and we mail them the aligners. They start their treatment remotely. They're doing the SDA. So we're seeing them for virtual appointments every time they put a new set of aligners in. They respect our time too. So, they want to come in when it's convenient for them. And at 6 months, when they're done, they come back for a final scan and we mail them the retainers. So it works out well for both parties.
Yeah. And I know some are all around the world too. So they'll go on trips all over. Jessica, you had some patients like that as well.
Yeah. I've had patients that, where I had a patient actually just on Friday who we started her with Smile Express, and she lives in DC, but she also has a house in New York, and she also has a house in South Africa, and then she was also going on a vacation to Europe, and I couldn't keep up with her life and where she was going to be. It sounded awesome, but I was like, totally fine. Take your aligners with you, take your scan box with you, and I'll be able to see you wherever you are. Yeah. And then I can even look on it regardless of where I'm at. I don't need to be in the office or in, Virginia to take a look at my patients too. If something comes up, and I can pull up their photos on my phone and look in a different country as well.
Yeah.
It's great.
We meet the patients where they are. Yeah.
Yeah. It's great for kids heading off to college too. We see a lot of Smile Express college kids. And so the parents are thrilled that we can actually get their result back to where they were a few years prior, and they don't even have to come to the office. So it's a win-win for us and for them.
Huge.
It's a accountability part of the scans too. It keeps them on top of things too. So it's especially with a college student, it's well, they didn't wear the retainer before. Now they're doing the scan. So then it keeps them accountable to make sure that they're getting the result as well. Makes the parents feel better too. So.
Yeah, Scott and Jessica can vouch for this. We treat a lot of the players. We have an office in Ashburn, Virginia. So a lot of the Washington Commander players come in, and it's exactly what you said. They don't have time. So, they were going to pay $3,000 for something, and they're just not educated, right? Yeah. So we started treating them, and then one tells the next, and now we have, we can say this now, we have Jaden Daniels is a Smile Express patient. So, one of the best, definitely the best rookie in the league. And, he's got a time crunch, right? We all do as professionals, right. But these guys, they we're in a big metropolitan area, as are many orthodontists. And it's a great service for patients. And the way I look at it is, if these patients are going to be treated elsewhere with no supervision, how can this possibly be a bad thing? It's not. We're using real Invisalign. We're using a different cut of aligners where it moves teeth well without attachments. It's programmed, and we're not going to talk about our preferences with it, but it's programmed to work without attachments before the different aligner cut. So we know what we're doing here. It works. It works just as well as having attachments in many cases, which we're learning more about comprehensive cases because of it, if that makes sense.
And we're doing a comprehensive exam too. So we're seeing the patient clinically. We're evaluating for periodontal disease. We're taking x-rays. So we know everything we're getting into from the get-go, and we can say no to treatment if we feel like it's necessary. But, all these DIY companies, there's no x-rays. They don't check for period.
Right. Totally agree. I mean, as well as if they get something done, let's say they finish, or in mid-treatment, they want to upgrade to comprehensive. They want to address other things. We'll allow them to 100% at any time. They can upgrade to comprehensive treatment. So that's one of the big benefits. Zach, how many patients have been treated successfully with Smile Express?
We're over 10,000 now and counting. So when I started in 2017 is when we launched it, just in my 4 locations, and now we're in 500 plus locations and 36 states, I believe, and over 10,000 patients treated successfully. And when we say successfully, we, I hear Jessica talk about this a lot. There's an orthodontist there. So if they need something, they call us. They can come in at any time, right? It's totally up to them whether they want to come in or not. None of us have ever turned a patient away from our office. So just, me as a a father of 3 and myself, if I know a doctor is there for one of my children, it makes me feel 1,000 times better. If I know I can get in touch with a doctor for something I need, it makes me feel better about things. And so the patient knows where they got their treatment. It's on their Invisalign case or their bag with their Invisalign. That's their doctor. So, supervise the entire time. It's for the patient. They know that they have someone to turn to at any time.
Love it. I told a patient that today. He actually had previously done treatment with one of the DIY companies, obviously didn't get the results he was looking for. And now, unfortunately is paying for treatment again, but this time we know it's going to be done right. And that's what I told him. And, he said, I explained SDA and dental monitoring to him. And I said, I'm going to be taking a look at you every single week. If you ever have questions, you can reach out. And he was like, oh, I've done something like this before. Like, I want to just have you come and see me in person, because last time I tried to do this remote monitoring thing, no one was looking at them. I couldn't get in touch with anyone. And I felt like my treatment just got off track. And I told him, like, I promise you, this will be a very different situation. And I said, the only thing that those companies really do well is marketing. They make themselves look like they are a real orthodontist with real Invisalign, with real results. And that's just not the case, as you've unfortunately seen. But I promise you, this is the real deal here. And, we will get you set up on the app if that's what you want, because if you really, he was a student, he was working, had a really busy lifestyle. And I said, I promise this is going to be really convenient for you. And, it'll also let me monitor your treatment really closely every single week. If there's anything that gets off track, immediately you'll get alerted and I'll get alerted. And I said, but also, if you want to come into the office, you're more than welcome to come into the office. Our offices aren't going anywhere. You know my name, you know our phone number. You can reach out on the app, and we have people in our office who will help get that message to me, and I will respond. I've even responded to people on SDA, like I've been, on vacation, and I've got a message that they wanted me to look at something with their treatment, and I can pull up the app on my phone and message them from, I can be in another country and they can be in another country, and I can be looking at their teeth. And, that's just unheard of with any other treatment, especially with what's out there on the market with these DIY. You really are DIY. You're on your own. You don't know the name of an orthodontist, or supposedly there might have been someone who looked at your teeth and, designed these aligners for you, but you don't know who it is. You don't know who to get in touch with. But, that's definitely not the case with this treatment. If anything, we are, more available than we've ever been before for these patients.
I love it.
Can I just wait? And I'm so sorry. I just wanted to say, there's nobody, we know how to treat as orthodontists. We specialize in treating the most complex of the complex cases. And just because we can treat all these complex cases doesn't mean that we should only treat the complex cases and need to fix everybody's bite all the time. Some people just want to have a cosmetic enhancement of their teeth. There is nobody better than us and our specialty to do this. This is easy for us. This is in our wheelhouse. Who else is patients are going to find somebody else to do it, whether it is a general dentist, whether it is one of these DIY companies, and there will be more of these companies. If we don't step up and take care of these patients, they're going to find treatment elsewhere. They're going to seek the treatment elsewhere. And, we do live in this instant gratification society. We do also have to educate patients as they're learning that Smile Express is even an option about, not doing veneers or this like quick and easy. It's, again, 20 weeks worth of treatment that we're talking about here. And so it's not a big commitment from them. We'll take it as far as they want to go. If they want to do more past that, as you had mentioned, you can always upgrade treatment. But it is always so much safer to try to align your natural teeth and put them into a better position instead of trying to cut down teeth and do veneers to close gaps, because veneers and any of that cosmetic work, it doesn't last forever. And so as we're thinking about the society that we live in with instant gratification, we do have to educate them that there is an option, shorter treatment, 20 weeks, let's get it as far as we can get. And then you could do those things if you absolutely need to. But once you do any of these other things to your teeth, it's irreversible. And then you have to maintain it for the course of the rest of your life. And again, I think important to say here that this treatment is for adults. This is not for children. We're not talking about treating children or teens with this. This is 18 and up. It might be somebody who had previous treatment that didn't wear their retainers. It might be somebody who had straight teeth their entire life. And then, maybe it's a mom and teeth started to shift after kids. And that was the patient that I had seen today too. It was like, okay, I just all of a sudden started shifting right after I had kids. Me too. I had the same thing. So again, it's important to note that, it is cosmetic, it is for adults. And again, we need to educate our patients on what can be done so they're not making irreversible changes to their smile.
Wholeheartedly agree. That was beautiful. I know how many of us on this call have done that braces limited treatment just to fix one or two little things for, as a favor for your neighbor or whatever. And a year and a half later, you're still going because they just find more and more. Someone talk about what are the benefits of just having 20 stages?
I mean, it sets a time limit on treatment. So it is, I'm committing to you. You have 20 aligners to get the job done. You're going to wear them and we're going to get as much done as we can, knowing that if you want perfection, we can always upgrade. You can pay for an additional scan. If there's other questions or concerns that you have along the way or want to start, as you see things improving, if you want to start working on bite correction, then we can upgrade to comprehensive Invisalign treatment or comprehensive treatment period, whether with brackets or whatever it may be in our office. So it sets that time period, which is great for us because as you had mentioned, things can go on and on and on in perpetuity and just always working on this little thing. It's like, you get what you get within this 20 aligners. Do you understand? This is what you get. Yes, I understand. You can always upgrade. And most of the time, if they're not okay with that, then they should be a comprehensive case from the beginning.
Exactly.
Yeah.
Exactly. That's exactly
I think
it.
To your point, Scott, we got to a point about 10 years ago where we stopped doing limited treatment in our office because it just didn't work. It didn't work for the patient, didn't work for the office. We were, we're going to do a four-month treatment. Here's your fee with aligners or braces, whatever it was. Next thing you know, you turn around, like you said, year and a half, 2 years. What are we doing here? And it wasn't good for anybody.
No.
So we dropped limited treatment. So this is just something that, like Amanda said, it holds the patient accountable and they're more compliant. And as an orthodontist, this is what we're doing. We have this many aligners, boom, we're done. And like Jessica said, we're monitoring treatment the entire time.
Yeah.
Zach, I totally agree with the accountability. So we review in the beginning, it's going to be 20 aligners. You have to be committed to wear them. If you wear them as designed, we've set up your ClinCheck, we've set up your treatment plan, you will have the perfect result. If you don't wear them well, and we get to that end of 20 aligners, there's an additional fee if you want additional aligners. And so that holds them financially accountable, and it really does motivate them to wear them much better.
Yeah. And I think the difference between this and, the limited treatment that we're talking about that never, was limited and we've all kind of, turned away from is I wouldn't call this a limited treatment. I would call it more a customized cosmetic treatment. It's really focusing on the cosmetics and it's customized to exactly what the patient wants. And, we talk about exactly what teeth bother them and how we're going to move them. And we show them the customized plan. We all individually go in and customize the treatment plans and the ClinChecks to make sure those movements actually happen. And, at the end of the treatment, they're able to then customize if they wanted to upgrade and do more. So I think throughout the whole course of treatment, the patient is very aware of what's being achieved, the timeline when they're going to get the results, because that's always the biggest question from patients too, is how long is my treatment going to take? And they want to know the exact time frame. They know within 5 months they're going to be done with treatment. So I think it's just a very clear understanding upfront from both the doctor and the patient of what's included, what they're going to expect, and when they're going to expect it. And I think, the patients are really, really happy with knowing that information as well. There's no surprises. There's no, treatment's going to be 6 months and then it ends up taking a year and a half. They really know exactly what they're getting and when they're going to have their perfect smile.
That's great. That's great. So many of you guys have been on stage, many of you guys have been on stage, have talked to countless orthodontists and educated many on Invisalign, on practice development, on all the stuff. you've had the chance to talk to some orthodontists who are not about this, who are naysayers, who say, "Oh, I don't know if this is the right thing," or they snub their nose at it. What are some of the things that perhaps a doctor on the fence who's considering this, but might be a little bit leery, is afraid what their colleagues might say? What advice do you have for them?
I would say, let's just say you're an orthodontist and your wife is looking for treatment. Okay. But let's just say you're not an orthodontist and your wife has no idea, or you're an orthodontist and your husband is looking for treatment and they have no idea. That's what you need to think about. So this is, and I'll just use it as myself. If my wife wanted treatment and I'm not an orthodontist, she may have no idea that one of these do-it-yourselves is bad. And so as an orthodontist, I want to be able to control that these patients get satisfactory results safely in an efficient amount of time, supervised by an orthodontist. As easy as that. Because they're going to do it, whether we do it or not. They're going to go to somebody else, or they're going to go to another system that's not even a human being with a dental license or an orthodontic license.
Right. Totally agree. I think it's the whole paternalistic model. I think orthodontists who are there to have kind of that mindset where patients are there to serve them versus how can we meet the patient where they are and bring them along. And so if someone just wants they want a custom cosmetic plan just for certain aspects, and they want it done in about half the time, and they want it done for about half the money, we're the answer for that. And that's what Smile Express is for them.
I think it's all just about educating the patient. I would say, some of my Smile Express patients, they come in and they could be a comprehensive case. They could get, they might be a little class 2, and they could get that class 2 correction with a comprehensive case if they wanted to wear elastics and they wanted to commit to a longer treatment plan and, a more investment from a financial standpoint. But I think as long as we're educating them about what their options are, which I always do with all of my patients, and then let them decide what's best for them, I don't think that there's anything else we can do as healthcare providers other than educate and then let the patient ultimately decide what's best once they have all the information. Because for some people, they're not able to invest for whatever reason, whether it be time, money, just what they're looking for in terms of their goals. They're not able to invest in a comprehensive treatment at that time, but at least they have that information. They may want to invest in it in the future, or they may really just be very self-conscious about their teeth and they just want a cosmetic improvement, and that is still improving their health. You're still improving oral health by correcting crowding, and you're really improving psychosocial health by, giving them a smile they're happy with. So, I think it's just about education and letting the patient know the options, and then letting them, being able to treat them, like you said, where they're at, and help make the treatment fit their needs, their budget, their timeline.
Yeah.
I think that since the pandemic, there's more adults seeking orthodontic treatment or cosmetic anything than ever before.
Mhm.
And, there is such a potential in our industry to continue growth if we learn how to better serve these patients. As we've mentioned multiple times, they're going to seek treatment somewhere. They may do veneers. They don't know that necessarily this is the best option. They may try the DIY. There is going to be a lot more marketing push. People are more aware that they're able to do something like this. So there are going to be more people coming to us regardless, looking for something like this. And I treat majority adults, honestly, and not by by the cosmetics of my practice, and especially opening de novos. Those are the first patients that come in, or the really complex, all of the adults. And I have surgical patients that walk through my door a million times a day. And I'm like, oh my gosh, what in the world? And I ask them, the first question I ask, what is your chief concern about your smile? What would you like to improve with your smile? And so it's asking those questions and then meeting them where they are. It's just, okay, they have a crazy open bite, crazy tongue thrust, class 3. they have a diastema. I just want to close this up. That's all I want. I know my bite, again, presenting all of the options, but then meeting these a lot of times adult patients, they don't want to be bogged down with treatment. They don't want to go through it. But again, I think there are so many of these people. It's going to continue to get more and more as people become more and more mindful of all of the cosmetic stuff available to them. And then on top of all of this, it's not just about Smile Express. It's also doing other cosmetic things. Like they're coming to you for straight teeth, but guess what? They also want white teeth. So 100% of these patients should be getting bleaching as well. So, I mean, every single one of these, I'm adding bleaching in, whether it's going to be a take home or an in office. Like there's ways to continue to help upgrade their smile because, as soon as I fix that gap, you're going to be like, oh, now I'm like, okay, I want straight teeth. So you build all that in. So again, the more that we can understand that we are cosmetic providers. I mean, I know we deal with jaws and getting everything perfect, but people are coming to us because they want cosmetic improvements. It's going to become more and more and more. And so we need to learn how to treat these people. And so let's do it now. And let's do it. Well, we have this amazing network of doctors. I mean, how many now across the country, 500 some practices that are now part of Smile Doctors. We have an amazing network of people that can provide great care for all of these patients that are seeking this.
I agree. No one wants straight yellow teeth, right?
No.
No one does. Okay, so this segment, this may be just for our Smile Doctors doctors. So please share with them if you could talk to a group who aren't doing Smile Express, who might be afraid of what the industry might think, or that they're judged, or that things could go wrong as far as the patients not being happy, and so they may come back and complain. Like what? Talk to your colleagues right now. I would just invite you to share with them and your partners, your Smile Doctors partners. What advice would you have for them? What would you say to them about doing Smile Express?
I mean, I can just talk personally because I think that I have really pushed the limits of a lot of things, I feel like. And, whether it's the braces behind the teeth and like meeting people, like I've done it all. And again, I'm trying to push the industry and lead the industry forward. And there are going to be a lot of people who are going to be just old school mindset, and that's fine. And, it's again, people are going to talk about you no matter what, whether or not you're doing something really great or whether you're stinking it up. So it's like, I don't worry about what people say as long as I'm treating people right and I'm doing right by my patients and giving them what they need. I think we just have to stop worrying about what other people might be saying. And people are going to say stuff about us. I mean, that's just because we're doing something different and they don't understand it. But I think the more that we can explain it, and then the more that we can show the results, and the more that we can provide happy patients with really great positive results and not have all these negative reviews all over the place, it's like we can show them that it can be done right and it can be done safely, and we can give the patients what they want, then people will finally start to see, but there's going to be people who are going to question. And I don't know. I mean, at this point, like I've just learned to just kind of let that go. And as long as I know I'm treating people right and I'm doing right by myself and my family and my patients, I tune a lot of that out. So I think we all have to be like that in order to get our industry and move it forward. And the other thing is too, and I was thinking about this because, it's like birth rate is down. Okay. Like this is like a whole different conversation. Right. But like things are changing, right? Like the good old orthodontics that we grew up in and that our mentors grew up in doesn't exist. So we do need to find a way to be creative on how we keep ourselves relevant. Okay. And it's not saying that we're doing anything that we shouldn't be doing, but we need to be creative and we need to step out of this box.
Right.
And
In
so
residency. Yeah. In residency.
Go ahead, David.
In residency, we're all taught to treat to clinical excellence, ABO standards. We want class 1 molar, class 1 canine, perfect over jet, over bite. But it's not like that in the real world. I mean, yeah, a lot of patients want that and we're happy to provide it. But I presented a comprehensive treatment plan to an adult last week, and she had a couple of missing posterior teeth. She had kind of a deep rubber bite. She was slightly class 2, and I gave her, a year and a half treatment plan. And when I left the room, I thought she was happy with everything. But my TC came out after and said, Dr. Jones, her sister was in last week and we're treating her with Smile Express. And her biggest concerns are just the crowding of her front teeth. And that's really all she wants corrected. And she wants to do it in a pretty timely manner. And she said, is she a candidate? I said, of course she is. So I popped back into the consult room and I said, you know what? This is how we're going to treat you. You're going to be done in 6 months. You're going to get the result that you want. Because if I don't offer that, she is definitely going to go somewhere else and get it.
I always go back to, in so many aspects of orthodontics, what would I do if this is my family member? And Scott and I talk about this all the time with not just Smile Express, but with everything. And so many times, if this is my family member, this is better for you than going to do something from home or going to a general dentist to treat you with a limited treatment. And then, just like Amanda said, Amanda's spot on. The world is changing, right? 10 years ago, we didn't have to even think about this because there wasn't the do it from home, do it yourself systems. But now we have to adapt. We have to pivot. We have to move. We have to do what's best for patients. And I agree with Dave. We can't treat every patient to class 1 because they're non-growing in class 2 by full step, and they don't want surgery. So that happens all the time, right? That it's similar in that if they don't want to go through a 24-month treatment, but they want cosmetic, changes and improvements, like Jessica said, it's beneficial in many ways. And the world is changing and we do have to adapt. And I would say to your original question, Scott, if you're an orthodontist and you're saying, hey, I'm not going to do this because this is not right it's just not right. Well, you're wrong. I'm sorry. You're wrong. Like, I hate to tell you, but you're back in 1997 or 2004, because this is right for patients. And I like to think, and I truly believe that we are doing something that's great for the profession, because we are now treating these patients. We're following them with records. We're watching them the entire way through, and we're doing it with real aligners, and we're real orthodontists.
Yeah. Love it.
And I think too, something that, patient or doctors don't necessarily think about is, we've all talked a lot about, that Smile Express can be applied to these patients who could qualify for comprehensive treatment but aren't interested in fixing their bite. But there's just as many patients that I treat that Smile Express is all they need to get a perfect result. They have a class 1 bite. They had, maybe had treatment in the past, or were just lucky that they didn't have a severe malocclusion, and they have a little crowding, a little spacing, and Smile Express gets them into that perfect, situation. So I think there's a lot of patients. I think there's sometimes a connotation that people think that Smile Express is a compromised treatment and that you're not treating them and getting a perfect, beautiful end result. And that's just not true. Like, a lot of people are ending with a perfect class 1 bite and a perfect alignment. And then there's some patients that it looks beautiful. It's a cosmetically, very nice looking smile. And their bite is very stable. Their bite's very healthy. And sure, it's not a perfect class 1 because there were different situations that limited that. But, I think that that's a common misconception, is that people think that anyone treated with Smile Express is getting a lesser, result or not that ideal end result. And that's just not true.
That's a great point. That is our go-to treatment for orthodontic relapse. We do it all the time.
100%. 100%. I would also say, we have a lot of smile doctors, docs, who are like, I don't want to cannibalize and take away a comprehensive case and downgrade them to Smile Express. And I think they may be overshooting the case acceptance rate of an 18-month or a 2-year braces plan to an adult. Like, they don't want that, and they don't even want 18 months of aligners. And so we need to be able to offer this to them. This may be the perfect solution that they want. They just want to fix the front porch. They just want that. And they want the benefits of that. When they smile, they don't have the one tooth that reflects a bunch of light in the selfie. Like there's just a little bit of something that they want. We need to be more realistic in how we're taking care of these patients. And I would say we need to own it. Just like Smile Doctors was when we started, we took arrows in the back from all the industry, and then we saw, man, I don't know how many followers begin to go, okay, this is the way. This is what's happening. We saw all these copycats start. We're going to see the exact same thing on Smile Express. It's just what it is. Except we have a real opportunity to jumpstart this and jump out in front and establish our brand nationwide and really get a hold of it. But what I can tell you is that when Smile Express patients come into your practice and they're requesting Smile Express and they're actively asking for it, and then we upgrade them, upgrade all of them to comprehensive, it's just not a great marketing spend that way. And so when patients come in and they want Smile Express because that's the target demographic that we're going, but then they get offered, oh no, you need comprehensive, then man, it really creates a bad name for that. And when we're insistent that that's the only treatment that they can get, then it just doesn't work out. So if it's realistic, if it's good, if it's something that won't put them in a compromised position, this is where we only rely on doctors and their licenses to make these decisions. And they want Smile Express, they want a short treatment, they want it in half the time and almost half the price. This is the solution for them.
I would say, it's one of those things like where just try it, and just do it. Like you have a case that's, you had all the time, every single day. We have teenagers that come, or not, well, I mean, like people who had treatment when they were teenagers, their wisdom teeth shifted their teeth, and now they're in college and they need like a little touch up. Use it on one of them. Just instead of, doing what a lower fee would be on something, just like literally just transition that right over to a Smile Express and be like, we have this great product, 20 aligners or less. It's a little touch up. The parents will love it because then they don't have to repay for like a full treatment, and just try it out and see how it goes. But you have to give it a chance. You have to give it a chance. You have to try. And before you say, no, I'm not going to do it, you are still the doctor. You still make the decision. If you need to do IPR, we can all talk about this too. You can still do IPR limited with Smile Express if you need to. So it's not like all or nothing. Like there's flexibility. Again, you're still the doctor. You're still in control. But I would just say before you say no, that this is not for me, or no, I don't want to do it, just have an open mind and just try it and then see how it goes. And you're like, actually that wasn't that bad. And that's actually, I charge higher than what I was going to do for a touch up of 6-month of braces or whatever it may be.
Yes.
Like you might find that you're pleasantly surprised on the other end.
I think one of the biggest ways to just like get people on board too is Zach said it in the beginning. I wasn't an associate with him when they started Smile Express, but if you ask the other 2 associates who were there, they will tell you too. Like Zach came to them and was like, we're going to do this Smile Express. And they were like, okay. And they like kind of thought he was crazy. And they were like, we're not going to say no to him because like he has great ideas and we're going to do it. And they just, they're great. They would never like say no. But they will tell you they were skeptical in the beginning and they were like, we're just, like Amanda said, we just have to try it and then see how it goes. And now we do so much Smile Express and they're the biggest proponents of it. So I think if these other doctors just get on board and try it, they'll be the same way.
You asked about the doctor getting the patient that comes in and they want Smile Express and they have heard about it, whatever it is, they want Smile Express and then you end up treating them with comprehensive. Well, I think what doctors forget, you're looking at the production, but you're not looking at the denominator, which is the amount of appointments. So Smile Express can be and is in our locations at NVO, it's the most profitable thing that we do. If you're just strictly looking at numbers. Yep. So take the production and then look at the denominator, the appointments, chair time, whatever you want to look at, however you quantify it. And it's more profitable. So if let's just forget about everything clinical for a second. Let's just forget about that. Because if you're going to try to take a patient, move them to comprehensive, forget about everything clinical. Obviously, we're treating comprehensive patients. They're 90+% of our patients at NVO. But if you just look at strictly numbers, and I'm not an orthodontist, I'm something else that doesn't matter. I'm doing it all day long. That's all I'm doing is Smile Express.
Yeah, because it was designed to be 2 visits. That's
Yeah,
it. So
that's it.
2 visits just to have it go like that. And I think if it's anything more, then we need to do a different type of treatment for that patient because that's what they need. So to summarize, Jessica, would you just tell us again, what is Smile Express?
Smile Express is a orthodontist directed treatment, orthodontist guided treatment that is perfect for adults who are looking for a 6-month cosmetic improvement to their smile. So at the start of the treatment, the patient will come in for a comprehensive exam with one of the Smile Doctor's orthodontists. We do full records, x-rays, scan, photos, meet with the doctor, discuss their concerns, discuss what we can correct, and we then do a completely custom treatment plan, completely custom ClinCheck for the patient of 20 aligners. The patient will then be given everything that they need to, complete their treatment. And they'll also be given Smile Doctors Anywhere and the remote monitoring app and the scan box so that they're able to, one, communicate with us throughout their entire treatment. If patients have a question or a concern, any time of day from start to finish of their treatment, they're able to reach out directly to the doctor that they know is treating them, the one that they met in the beginning. They can also always come into our office if they have any concerns or questions, but everything that we're able to see everything remotely, just through their app. And they're going to be taking pictures of their teeth every single week so that we can see their treatment progress. And then at the end of those 20 weeks, the patient comes in just for one final appointment. So their second visit in our office total. We do final records and we scan for a final retainer. And then the patient just wears that retainer at night. We can continue to see that patient, for retention visits as needed. If the patient, forever has any questions or concerns, they know who treated them. And we can help to, see that patient and answer any questions that they have. And at the end, in 6 months, this patient had a treatment with Invisalign by a leading Invisalign doctor, and they were able to achieve their smile that they were looking for at a lower cost and at a lower price point. And this is something that has really never been offered before, that patients are able to have a treatment that meets their timeline, their budget, and still get the results that they're looking for in a very safe and healthy way.
Wow, that is awesome. I am so excited about this, of what we're offering patients, the difference it will make in so many lives, as well as the example that you guys are pioneering. And Zach, thank you for inventing and for starting Smile Express for other orthodontists and the orthodontic industry at large to follow. This is the future of meeting patients where they are, taking care of them to the degree that they want, and just really creating beautiful smiles all around. So thank you guys for your time today, for sharing your insights, and I just appreciate it. So let's go do this. Thanks.
Thank you.